From the JAMA Network, this is JAMA Pediatrics Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Pediatrics.
Hello again, podcast listeners. This is Dimitri Christakis, Editor-in-Chief of JAMA Pediatrics, coming to you again with our monthly podcast. Joining me, as always, is my good friend, colleague, Associate Editor Dr. Alison Galbraith from Boston Medical Center. Hi, Allie. How are you?
Hi, good.
And a special guest today, Dr. Aaron Carroll, President and CEO of Academy Health, formerly of the University of Indiana, and one of our associate editors as well. Aaron, it is great to have you here.
Thanks for having me.
So we're doing something a little different today. In light of the upcoming election, we will be discussing some policy-relevant papers, and we published an editorial talking about the interplay, if you will, of politics and science. And, the gist of it, a very strong editorial feeling that politics shouldn't influence science, but science should influence politics. And in light of that, we've had a call for scientifically based papers that should inform policy in light of the upcoming election. I'm curious, before we get into that, your thoughts on that. I mean, I think most people on all sides of the political spectrum believe that we should have science-based policies in place. The challenge is, how do we operationalize that? Do you guys have thoughts on how to do that or why we can't do that? I'll kick it over to you first, Aaron. I know you've thought a lot about this. You sort of live in that space.
So I think part of the problem is, one, there's so much being published all the time that it's too easy to cherry pick. You can go out and find a study, and people can't see I'm making air quotes around study, but it could be a flawed study that could just justify whatever policy you're trying to get at. I think another thing is that it's so hard to do good research on policies, because how do you isolate the effects of a policy alone and not take into account all of the other measured or unmeasured factors that also might be changing? Because of that, I think people tend to throw up their hands and say this just can't be studied and that we're just going to have to disagree. But for so many focused questions, there are good studies that can help us get to that, which means studying individual components about policies or trying to get at smaller changes that might happen is really possible and can help us inform what might be better in terms of outcomes. In an ideal world, I think what we would all agree on is that we'd have a question, and even across the political aisle, we should be able to agree that, look, we should be able to put together a good study to measure this. And let's all agree together, if we put together such a study and we look at the outcomes, that we're all going to abide by them.
But that's our job, right? Like, our job is to vet these studies really carefully and apply rigorous designs, because you can do policy research,
Sure.
Right, Aaron? Like you're saying, like you could also publish lousy policy stuff, but that's our job, is to try to get that stuff out there and vet it.
That was the point of this theme issue, and maybe that's a perfect segue, Allie. So we put out this call, we vetted the studies, we published ones that we thought were important and well done. Which ones stand out to you as having great salience that we should highlight here in this podcast?
Well, by the way, we had 20 plus empirical research papers and then also some viewpoints and editorials. So there's a lot of research out there that's great. I feel like it came in sort of two categories. One was to describe some sort of problem that I think people might not be realizing, especially because people don't think about kids all the time when they're thinking about policy stuff. So I think we have some papers like that. And then I think we also have papers that test policy and see what the impact is to see if they work or if they don't work. So I have a couple of examples of both of those sorts of things. This is a paper by McQuillan and colleagues on transgender, adolescent school climate, mental health, and adult social support, the 2021 Wisconsin Youth Risk Behavior Survey of high school students. And they found that transgender students had higher rates of reporting bullying, skipping school due to feeling unsafe, depression, self-harming behaviors, and suicidality compared to their cisgender peers. And then they also found that among the students who said they felt depressed or anxious, the transgender students were more likely to seek help from adults in schools than parents, friends, or siblings compared to their cisgender peers. And so schools, where a lot of the debate is happening on some of these issues, schools are both sites of victimization, but also sites of support for transgender youth. So that's important because there are so many policies that are related to what happens at schools. And so I thought that was a really important paper to be out there.
The question is, how do we take this kind of good data and use it to convince others that it's necessary in a variety of ways? One, that we still have a climate where LGBTQ plus children and adolescents feel negative effects of society in such a way that it's hurting their mental health. But I also think that you're right. There's the flip side of how much we need to keep relying on schools as the place where we can intervene on this. It's one more reason why we need to keep focusing on schools as a place where we can intervene and do better by kids, especially adolescents who are at risk for a variety of other reasons. And given that students obviously have access to home, but still are reaching out at school, says that either their needs are not being met at home or their needs are just more than can be met at home. But either reason, it's important. And we know it. This is again where it's like, this is data. It's evidence that shows that students need this and are seeking it at school, and just saying, well, just deal with it outside of school in your private life isn't getting the job done.
As economists would say, it's an express preference. They voted with their mouths, so to speak.
And that kids need to feel like they're safe at school and that they want to go to school, right? Like we have to think about ways to make that more possible for kids too, because these data are showing that they don't want to go to school. They don't feel safe there.
What's the next one you want to talk about?
This is sort of related to the point that Aaron was making about what people do with information. And kids are in school a lot, but they also get a lot of impact from social media and just the media in general. And Clark et al. Did a study about looking at the effects of media on LGBTQ youth. So they did a survey of LGBTQ youth who had a history of suicidal ideation and depression. And they were able to see before and after they were exposed to LGBTQ negative news and media, what their suicidal ideation intensity was. And they found that suicidal ideation intensity increased in the hours following exposure to negative media. So this is even more saying that we have to be really careful how we talk about these issues and how we convey information and evidence.
Yeah. And I mean, these days, it's all too easy to turn on news and see negative portrayals of LGBTQ positive youth and also just issues in general. And it's important to be reminded that these have real effects. I'm even struck by the fact that we have good evidence that the way that media can portray even just suicide in general can have a contagion effect if it is not properly discussed. And this is good evidence to show that it's real.
What you're saying is also making me think about how important it is for us to be able to rethink our assumptions, or for everyone to, right? Like everyone has a narrative and people play into their own narratives. And I think one of the things that we can do with evidence is to be able to vet it and put it out there, even if it makes us rethink our scientific and other assumptions. And so this happened for me, this study by Klein on characteristics and obtainment methods of firearms used in adolescent school shootings. They found that the majority of school shootings involve lower to moderately powered firearms rather than high-powered weapons, which is something that a lot of people are calling for bans or stuff on high-powered weapons. And so they actually found that most of these shootings did not involve those weapons. But the majority of the shootings also came from the perpetrator's family or friends, which was also important because, maybe we should be focusing our efforts on policies to increase safe storage of these lower and moderately powered firearms that are responsible for more of these.
Yeah, this study really resonated with me because usually we make this argument just in terms of deaths in general, that so many of the firearm-related deaths that occur every year in the United States are suicide. And again, they're often from a gun that is legally owned in the house and just not stored safely. But really what accounts for the vast majority of deaths and injuries are handheld guns. They're handguns. And it has to do with storage. What I found interesting about this was that even with respect to school shootings, we're looking at the wrong things, focusing perhaps on safe storage and on handguns and not necessarily on assault rifles will actually do much more good than continuing to focus on what makes the news, but isn't necessarily the major driver of morbidity and mortality in the United States.
As this article points out, while that may be a worthwhile aspiration, it's likely not to move the needle on something that people seem to care very deeply about, which is school shootings. So what's missing there?
I mean, I actually think that this is another good chance for us to focus as a field, to focus on safe storage and how much of a difference better education and safe storage will probably make more of a difference in terms of reducing the number of gun accidents, gun deaths, gun shootings, even among children, than all the assault weapon bans in the world. And it probably would be even more palatable to those who want to own guns. That's totally fine. Let's talk about how you store it safely and how you keep your kids safe at home rather than trying to make it harder for people to get guns or own guns.
Oh, wait, I have an example of one of our papers that actually has gotten the attention of policymakers. So I feel really good about that. So this was a study by Kazanchi and colleagues called Mandatory Child Protective Services Reporting for Substance-Exposed Newborns and Peripartum Outcomes. So they did rigorous difference in difference analysis. They were looking at a policy in Massachusetts where there's mandatory reporting of all prenatally substance-exposed infants to Child Protective Services. But that can be very stigmatizing, and there are a lot of pregnant individuals who are stably on medication-assisted therapy for substance use disorder, and there aren't protective concerns, but then they have to worry about being reported again. So they looked at a policy that instead of it being mandated, it was requiring only reporting for specific protective concerns. And so they did a difference in difference analysis and looked at what happened with CPS reports and actual retaining of infants in custody. And they found that the policy requiring reporting only for specific protective concerns resulted in a reduction in CPS reports, not surprisingly, but no significant change in the custody at discharge. And so this policy, the state of Massachusetts is now considering removing this mandate partly based on this evidence. So that's encouraging.
Such a good example because it's listening to the concerns of those who disagree. So, of course, the reason a policy like this is put in place is because people think, oh, if we don't mandatory report this, the kids are going to slip through the cracks. So therefore, we have to make sure that we do the maximal amount to catch every child. And it says, okay, great. We hear you. That's the policy in place. But let's see what would happen if we didn't. And they did. And it turns out that it reduces the load on CPS, which is already overburdened. It uses them for what we need them to be used for, which is focusing where there's an actual raised concern of maltreatment or neglect or something along those orders. And it wound up taking away, didn't result in children slipping through the cracks. So again, it's good. And I hope that Massachusetts and other states will take this up. But it specifically was designed to get at what the specific issue of concern and to check to see, is that concern valid? And it turns out it's not. And hopefully policy will get changed.
Well, this has been, I think, really illuminating. I want to thank you guys. And I want to emphasize what Ali said. We touched on 4 of, I think, 20 or so papers that we published on this theme issue. So please go ahead and find them, read them, disseminate them, talk to your local representatives, your school principals, any way that you can help bring science into public policy, I think will make the world a better place. Thank you very much, Ali and Aaron. Thanks for being here.
And go vote. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.